Annie Andrews is a pediatrician and a mother who's now the Democratic nominee for the 1st Congressional District. I speak exclusively with her about gun violence, infrastructure, and abortion for this special edition of Quintin's Close-Ups. And if you haven't already, subscribe to my YouTube channel and like Quintin's Close-Ups on Facebook. Dr. Annie Andrews, welcome to Quintin's Close-Ups.
Thank you for having me.
You know, me and you met earlier this summer over at the Ripple in downtown Charleston, and that was my first time actually meeting you. And I know at the time you were busy campaigning for, obviously, the 1st Congressional District. I know that you, too, are obviously a pediatrician, a mother, and the Democratic nominee for that particular district. Let me ask you this. With all your experience under your belt, Dr. Andrews, why this? Why now?
That's a great question, and the answer is really twofold. First, I decided to run for Congress because I have gone to work every day for the past decade at a children's hospital, where I have the privilege of caring for the children and families of the Low Country, but where I also see all of the problems that are facing the most vulnerable among us, the children and their families. You know, I take care of kids who don't have enough food to eat at home. I take care of kids who can't access the internet in their homes. I see kids who have to spend the night alone in the hospital because their parents are juggling multiple jobs just to make ends meet. I take care of kids who are struggling with chronic asthma or have just been diagnosed with diabetes. And far too often, the parents of those children have to pause and ask me if they can afford the asthma inhaler or if they can afford their child's new diagnosis of diabetes. I also have cared for so many children who are in the throes of mental health crises and can't access mental health resources in our community. And I have cared for so many children, Quintin, who have been shot. So when you go to work every day at a children's hospital, you can't help but notice all of these problems. And so I started looking for problem solvers in Columbia and Washington, D.C., and I didn't see enough problem solvers who were focused on fighting for what all of our children need and deserve. And so that's why I decided to run for Congress.
Well, let me ask you, I want to get to that in just a second, Dr. Andrews, but as you know, there's some still developing news out there, and this is coming from the Hill newspaper. South Carolina Democratic House candidate Dr. Annie Andrews slammed Republican Congresswoman Nancy Mace Wednesday for, quote, bigot attacks through campaign ads, accusing Andrews of treating children as young as 4 years old with gender-affirming care. Andrews, who works at a local hospital here in Charleston, says she is now taking an unpaid leave from her job and has increased security because of Mace's attacks. Let me ask you this, Dr. Andrews. How did we get here?
I think that's an important question. I'm not sure I know the answer, but it's incredibly disheartening and disappointing to me as a citizen, as a parent of children who I believe should be able to look up to our leaders and not worry about their leaders bullying them. So, you know, essentially what happened is when my opponent launched those attack ads, which were really fueled by bigotry and built on lies, she not only was, you know, falsely claiming that I provided.
Yes, ma'am. I think. Oh, wait a minute. Oh.
These vulnerable children. So incredibly vulnerable. Over 50% of trans youth have considered suicide, and a third of trans youth have actually attempted to harm themselves. So it's a political game to my opponent to use these vulnerable kids in her political games. But to me, it's very, very serious because while I don't actually provide gender affirming surgery or care, because that's not within the scope of my practice as a pediatric hospitalist, what I do is take care of transgender youth when they are admitted to the hospital after they try to kill themselves because they're not accepted by the adults in their lives, whether it's their parents, their teachers, or now, sadly, their elected officials who are bullying them and ostracizing them for political gain. And so frankly, it's disgusting. And we have far bigger problems in the Low Country and in this country that we should be focusing on in this election.
I want to get to that in just a second, but as a side note, I attempted to interview Congresswoman Nancy Mace for Quintin's Close-Ups, and this is an email from her public press secretary, that is, in Washington, John Seabills. He says this, quote, "Hi, Quintin. Thanks for reaching out. At this time, we will have to decline this request." So I hope to get Congresswoman Nancy Mace on Quintin's Close-Ups soon to talk about this and get her side of the story. But what is the suicide rate right now amongst transgender youth in the 1st Congressional District?
Yeah, so, up to 50% of them, or about 50% of transgender youth across the country, have contemplating hurting themselves, and a third of them have attempted to hurt themselves. And this is a mental health crisis. All youth across this country are experiencing, increased rates of mental health problems, but specifically, these trans youth are incredibly vulnerable and just so deeply misunderstood. And, frankly, I expected more from my Congresswoman. Her accusations of me being a child abuser are frankly ridiculous, and the constituents in this district deserve better. They deserve a leader who's focused on the problems that we're facing, like our gun violence crisis, like our crumbling infrastructure, like climate change that has the crosstown underwater, so many days out of the year. She should be focused on finding solutions to those problems, not bullying vulnerable children and attacking me in the way that she has.
But going back to the suicide rate, Dr. Andrews, what exactly is that in the first congressional district when you think of trans youth who want to commit suicide, unfortunately?
Yeah, so I don't know the local data, but I think we can extrapolate the national data to expect that a third of trans youth in the Low Country have attempted to harm themselves, and 50% of them have, thought about harming themselves. And that's just extrapolating the national data here locally. There's no reason to expect our rates would be any different. And frankly, based on this recent intense bullying on social media, I worry that those rates are even higher.
Now, what are the other mental health problems do you see within the trans youth here in the Low Country?
Yeah, I mean, it's a combination of anxiety, symptoms of depression, and then these self harm behaviors. Because these children, when they don't have an affirming adult in their lives, are much more likely to experience these symptoms. It really takes one supportive adult to reduce the incidence of these psychiatric symptoms among these children. And as a pediatrician, I consider it part of my job to be that affirming adult whenever I am given the opportunity to do that. So when I see these children in the children's hospital after they have attempted to harm themselves, my job is to provide medical care, to stabilize them from a medical standpoint, to get them the psychiatric care that they need, but to be that affirming adult, to affirm who they are and to help them combat all of the disinformation, misinformation, and bullying that happens outside the hospital walls.
Actually, this, Dr. Andrews, would you advocate against science-based gender reassignment?
So, talking about gender affirming care, broadly, that includes medical interventions, which can include puberty blockers once youth reach the age of puberty. It can include sex hormones after puberty blockers. And in adults, it can include what you called sex reassignment surgery. So, gender affirming surgery, sex reassignment surgery has never been done on a minor at MUSC. I have never cared for a patient who has had gender reassignment surgery. I have never referred a patient for that surgery. I do not support those surgical interventions in anyone under the age of 18. Once they're adults, certainly it's their decision to do so. But any accusations that I promote or support surgery, sexual reassignment surgery in anyone under the age of 18 are frankly just flat out false.
So let me ask you a redundant question. Is sex changes for 13-year-olds appropriate?
So the surgery, absolutely not. But I think we need to take a step back and consider that we're having a very sort of nuanced, complex conversation about a really complex medical diagnosis of gender dysphoria. And, I am a pediatrician and I'm board certified in pediatrics. So in a way, I'm qualified to have this conversation. But most of the folks out there who are chiming in online are really not qualified to weigh in. And frankly, these conversations should be between mental health professionals, medical doctors like myself, patients, and their parents. So absolutely, just like the American Academy of Pediatrics, the American Medical Association, the Endocrine Society, all of these big mainstream national medical organizations who say that gender affirming care, which can mean something as simple as being kind to a youth who is exploring their gender expression. Gender affirming care is supported by the science, supported by the data, supported by these national mainstream medical organizations. As a physician who practices evidence-based medicine, I absolutely support gender affirming care for children. I do not support gender affirming surgery in minors.
Now, let me ask you this: how many of those teens actually are exploring their gender right now in the first congressional district?
I don't have data specific to the Low Country. That is data that is likely available from the folks who work in the clinics where this care is given. I can tell you anecdotally, though, when I started as a pediatrician back here in the Low Country back in 2009, I really don't remember caring for transgender youth who tried to hurt themselves. I remember vividly multiple cases of caring for these youth over the past several years. And so I do think that the incidence of these mental health crises are increasing among this population. And it is deeply concerning to me that, again, we're having a conversation that is bullying these transgender youth, not you and I, of course, but my opponent is leading this bullying. And, I'm a pediatrician and a mom. We should never bully anyone. No one should. And certainly our congresswoman should not be bullying vulnerable youth.
So what is the population for trans youth here in the Low Country right now?
So I don't have that data. I don't know. That's a great question. I'm not sure who would have that data. But, I don't know. Again, though, my job is to serve all of the children in the Low Country.
And I'm gonna talk to you more about that in a second, but I got to get to some more issues here, which is obviously affecting the district, as you know. But let me ask you this: Nancy Mace, or Congressman Nancy Mace, that is, I should say, said this about voter ID a couple of months ago. She says this quote: "Voter ID is not racist. If you got to provide an ID to board a plane, rent an apartment, or buy a pack of cigarettes, it's only fair that in support of one of the most sacred rights, the right to vote, that we show an ID to protect the vote." But isn't comparing the voting to something you purchase is a fair comparison when you think of the 24th Amendment?
I think that is a really great question. And I think we need to work diligently to increase access to the polls for every eligible voter in the Low Country, in the first district, and all across this country. The fact of the matter is we have one political party in this country that isn't interested in proposing popular policy positions or proposing solutions to any of the problems we face. Rather, they know they can't win if we have a conversation about policy, because they know they're on the wrong side of so many of these issues, including abortion, including solutions to the gun violence crisis. So rather than having a conversation about the problems, they want to decrease access to the polls. So we need comprehensive voting rights legislation in this country. My opponent voted against the John Lewis Voting Rights Act. She supports partisan gerrymandering. We need to end partisan gerrymandering. We need independent redistricting commissions, and that will help us address our lack of access to the polls. I have a brother who lives in Colorado where every registered voter gets mailed a mail-in ballot. Regardless of if they request one, they just all go out to all the voters. And that is a way to increase access to the polls. We need access to the polls here in South Carolina. I'm happy we have no excuse early voting that starts October 24th, this election cycle. That is one step in the right direction, but there's so much more we could do to increase access to the polls. And certainly this is a racial equity issue. These are targeted laws that try to discourage voting from certain segments of the population.
So if you were to emulate that is what's going on in Colorado right now, Dr. Andrews, how would you do that in South Carolina, and how much money would that cost the average taxpayer?
That's a great question, and I don't have the answer to that, Quintin, but I think certainly that would be something we would have to consider if we were ever to think about, and certainly this wouldn't be within my purview as a congressperson, but I do think that our state should get serious about ways that we can, with fiscal responsibility, increase access to the polls, because discouraging voting is not healthy in a healthy democracy.
When a voter actually registers to vote, should they just have a card sent to them that they can only use to vote?
I think that's a great proposition as well. If you're a registered voter, any way we can make it easier for people who are eligible to vote, I would be in support of.
Would this eliminate the obstacles and costs of actually obtaining that is an ID or birth certificate, etc.?
Mm-hmm. Yeah, I think it could. I think that I think that right now we're having a substantive conversation about what we can do to increase access to the polls. What they do in Colombia is spend all of our taxpayer dollars fighting over these culture war issues like abortion and guns and these anti-trans bills. They waste so much time in Colombia talking about those issues that they never have conversations like this, talking about things that really could help the state of South Carolina. So I'm glad that you're asking these questions, and I wish we had more conversations like this in Colombia.
Welcome to Quintin's Close-Up. And speaking of gerrymandering, that is, my tongue was twisted today. But let me ask you this: Congresswoman Nancy Mace also said this on Twitter: "Quote: Voting laws are put in place in different states to actually protect voter rights, not to oppress the vote." So, what exactly is your view of gerrymandering in the first congressional district?
So I think it's plainly clear that this district has been gerrymandered. It's been gerrymandered for some time, but when they redrew the lines this past year, it's even worse. You know, it's actually two concentric circles that are not even connected by land, only connected by water. And anyone who's lived in this district for as long as I have or longer understands that the peninsula, West Ashley, James Island, Mount Pleasant, all are part of a community. And there is absolutely no reason that downtown Charleston should be represented by the same congressperson that downtown Columbia is. But this goes back to what I was saying before, is they know they don't have popular policy positions. So rather than try to win on their ideas, they try to stack the deck in their favor. And they try to do that with these congressional lines. But the fact of the matter is, my opponent is deeply unpopular. Her position on one of the top issues of the day, which is abortion, is deeply unpopular. And she knows that. So she's still at risk of losing the seat, despite the fact that the Republicans in Columbia tried to draw the lines to make it easier for her to win.
How long have you been living in this district?
I moved here in 2009. My husband and I moved from Cincinnati, where we met. We both did our medical school training there in Cincinnati. And then when he graduated medical school, he actually matched at MUSC for his emergency medicine residency. And that's what brought us down to the Low Country initially. I came a year later after I finished my residency training at Cincinnati Children's Hospital, and we both immediately fell in love with life in the Low Country and chose to make this our home. We got engaged on Folly Beach. We got married at Patriots Point. My kids are in the public school system over in Mount Pleasant. My parents have since retired and moved here, so this is home. We are so blessed to live in such a beautiful, beautiful part of the country, and I'm just really excited about the opportunity of representing the Low Country in Washington, D.C.
When you talk about moving from obviously Ohio to here, where exactly were you born and raised?
Yeah, so I was born in Western Kentucky, but I only lived there for less than a year. And then I spent my whole childhood in a suburb of Indianapolis. So I grew up in the northeast side of Indianapolis, where I grew up with my two brothers. I'm a middle child, only daughter. Grew up in a house with my two brothers and my parents. My mom is a retired educator. My dad was in the business world in Indianapolis and had a really lovely childhood, you know, a really privileged upbringing there in Indianapolis. And none of my family lives there anymore. They've all scattered about the country. And then as I said before, I went to Ohio for undergrad at University of Dayton and then medical school at University of Cincinnati. And then was really fortunate to be able to train at Cincinnati Children's Hospital, which is one of the biggest and best children's hospitals in the entire country.
And I remember when we've spoken during the summer, you told me that one of your brothers actually live in Nashville.
That's right. Yes, one of my brothers is in Nashville with his family, his two small kids and his wife. And my other brother is in Denver. He's a lawyer out there, and he is also married and has two kids. So lots of grandkids in the family.
Yes, and I'll be back to Nashville soon, actually. So I'm excited about that, going back again. Yes, yes, indeed. But let me get serious again and talk to you about obviously voting laws. How many polling stations have been actually reduced in minority districts?
Yeah, I don't know the answer to that question. Do you have that data? I know that there's a trend to make that happen, but I don't know here in the Low Country.
Let me turn over to obviously the infrastructure bill that has been talked about for at least 2-3 years now. I know Congressman May said this quote: "The infrastructure bill is a down payment on a Green New Deal." Is this a Green New Deal 2.0?
No, and I think that's just a typical Republican talking point. I think first, the Green New Deal is not a piece of legislation. It's not something that is being seriously discussed. The infrastructure bill has nothing to do with that. The fact of the matter is my opponent is not interested in getting serious about climate change and getting serious about transitioning to a green economy, which is something that, regardless of what your political affiliation is, we're not going to have a choice. Like, the clock is ticking, the climate is changing. We need to see this as an economic opportunity, not a challenge. We need someone in Washington, D.C. who understands that climate science is real and it is human made. And, you started this question by asking about infrastructure. And so I like to look at it this way. If you are a lawmaker and you cannot get serious about funding our infrastructure, fixing our roads and bridges, you don't have any business writing laws. That would be like me as a pediatrician, wanting to be a pediatrician, but refusing to take care of kids with ear infections. This is the bread and butter of lawmaking. If you can't work across the aisle to help us fix our roads and bridges, then frankly, you really have no business representing us in Washington, D.C. You know, Secretary Pete is coming into town to talk about all the money that's coming to the district from this infrastructure bill that my opponent has no problem standing in front of the cameras at the ribbon cutting ceremonies for projects she voted against. And that kind of hypocrisy is what I, as a citizen, am just tired of seeing. We need people who are willing to solve the problems of the day, and the most basic of which are fixing our roads and bridges.
Go back to what she said. She said this quote, the infrastructure bill is a down payment on the Green New Deal. Let me ask you, what happens when we don't pay the actual deficit?
So, I think every election cycle we talk about government spending. And I'd like to say that I, just like my predecessor, my Democratic predecessor, Representative Cunningham, I support the balanced budget amendment. I live in a house, a busy house with 3 kids. My husband and I both have paychecks, and we balance our budget as a household. We live within our means, and our government needs to do the same. But the fact of the matter is there's all this finger pointing about who spends more money, Democrats or Republicans, and there was a lot more government spending under Trump than there has been under Biden. Things cost money. We have to solve problems. The government has to step in and help the citizens, but we have to do it in a fiscally responsible way. We do need to take a very critical eye at all of our government spending and figure out where there's waste so that we can prioritize those things that matter to us. But this finger pointing, saying that Democrats are, irresponsible fiscally is just not supported by the facts.
Well, let me ask you this, Dr. Andrews. Do you believe that they are actually using the same infrastructure plans that were supposed to be fixed under the Obama administration?
I mean, I think that, the Low Country has needed an influx of money to support our infrastructure for a long time. People talk all the time about driving across our bumpy roads full of potholes. We have, sunny day flooding on many of our low-lying streets. So, this has been a problem for decades. It's a problem that we often just keep kicking the can down the road. And that's why I'm so pleased that this administration got serious and passed the bipartisan infrastructure bill that is bringing much needed dollars into the Low Country. And let's not forget, this was a bipartisan bill. Senator Lindsey Graham voted yes on the infrastructure bill because he understands how critical this is to the needs of the whole state of South Carolina. But my opponent could not put aside her partisan politics to vote again to fix our roads and bridges. And that to me should be disqualifying.
In 1989, most Americans paid for rural broadband, school technology, etc., with phone line surcharges and, of course, the E-rate taxes. And reportedly, people are still paying for these fees, reportedly today with the same phone number. And the Obama-Biden administration spent billions on infrastructure that was supposed to be shovel-ready by 2009. Why do you think people are still paying for this?
I mean, I think it's a problem. That's what I'll say. Why are they still paying for it? Because we haven't gotten serious about addressing inequity in access to things like rural broadband. And I know Congressman Clyburn has been incredibly pivotal in bringing more broadband to the state of South Carolina. And so I see it in 2 problems. My vantage point as a pediatrician and a mom, I'm always thinking about how this affects kids. So this affects kids who can't do their homework at home because they can't access broadband. They drive to the local McDonald's and sit in the parking lot to log onto the internet. In 2022, we should not have that kind of inequity in our access to the internet. You cannot get by these days as a child without access to the internet. The other way I see how critical this is with telehealth. South Carolina is actually leading the way on telehealth across the country. We have really innovative telehealth programs in the state of South Carolina. My husband works for one. He works for the MUSC telestroke team, where they are able to, through the internet, log into emergency departments all across the state of South Carolina, provide that fast, rapid response to patients who could be experiencing stroke symptoms. But you can't do that if you don't have access to the internet. Kids with asthma do telehealth visits into MUSC. Again, a lot of those kids have to travel to McDonald's to do their telehealth visit with the provider at MUSC. We need equitable access to internet all across the state, and education and healthcare are just 2 of the reasons why.
So if in 15 years, Dr. Andrews, and if broadband is a thing of the past that many people are really scared about, will Americans still be paying for that?
I mean, I hope not. I hope we can get serious about recognizing that this is the bread and butter of infrastructure in 2022. The internet is part of our daily lives, and we need equitable access to the internet.
Let me turn to the big issue of this campaign, that is abortion. You said this on Twitter recently. You said this quote: "A lot of people have asked me, why isn't Nancy Mace just running on her record? Isn't that what an incumbent should do?" You said this too: "I may be new to politics, but I think it has something to do with this." And you later obviously listed the things that Congressman Mace had voted actually no on. But then let me ask you this, Dr. Andrews. You are actually asking why she did not vote for the Biden-Pelosi agenda. But isn't President Biden's approval rating 40%? What's the approval rating for him here in the first congressional district?
I don't know what his approval rating here is, and I think it's we nationalize these elections so much, and that's what my opponent tried to do when she was running against Joe Cunningham. She tried to make it a competition between her and the Speaker of the House. But this is the two people in this race are Nancy Mace and Annie Andrews, and she needs to run against me. And I tweeted that because it is so true. I am new to politics, but I do understand that typically an incumbent has the opportunity to run on their record. She's had almost 2 years now in Washington, D.C., where she's had the opportunity to deliver for the Low Country. So she should be, on TV. Oh, my sign is falling down. She should be, hold on, let me get that.
Okay, take your time.
She should be on TV talking about all the wonderful things she's been able to do for the Low Country as our congressperson. But the fact of the matter is, she has just this tendency to vote no on all the things that matter to us. We already talked about the bipartisan infrastructure bill, but on the issue of abortion, she voted against codifying Roe. After Roe fell, she was the one woman from the Low Country who had the opportunity to stand up and to be brave and to do what we need her to do, to vote to codify Roe. She voted against that. She also had the opportunity to vote on that bill that would allow women in states like ours, who are in the process of enacting these really severe abortion bans, allow women in our state to leave the state to seek abortion services outside. She, instead of voting on that bill, she took a walk. She didn't vote on that bill. She is one of the co-authors of our extreme 6-week abortion ban. And right before the Dobbs decision leaked, she actually joined as a co-sponsor Marjorie Taylor Greene's personhood bill, which was a life begins at fertilization bill, which would ban IVF and which would ban all abortion. And that is the most extreme position on abortion. She joined that bill right before the Dobbs decision. And now she understands the political consequences of being so extreme on that issue, because that is not where this district is on that issue.
Let me ask you, do you support a woman's right to partial birth or abortion?
So, Quintin, unfortunately, that is not a medical term. So partial birth abortion is one of those buzzwords that's used by the opposing political party to enact an emotional response. So the medical facts about abortion, the vast majority of abortions in this country occur in the first trimester. Less than 1% of them occur after 20 weeks. At 20 weeks, that is when women get their anatomy ultrasounds. That is when women with wanted pregnancies find out that their babies have devastating deformities. No skull, no brain, intestines outside of the body, severe, severe deformities. And these women, these families, are asked to make impossible decisions about what they're going to do with that wanted pregnancy. And what our lawmakers, are primarily white male lawmakers in Columbia, are doing is taking away choices for those women who are in devastating situations that none of us ever want to be in. And they're saying that we know better. We're not going to give you choices. You're going to have to carry that pregnancy to term. So abortions that occur after 20 weeks are incredibly rare and always incredibly difficult situations. I have said this multiple times online. Third trimester abortions for convenience are not a thing. The data supports that does not happen. Women do not use abortion as a method of birth control. And there is so much misinformation swirling this debate, and my opponent is incredibly guilty of that we need to start having a conversation that's more in line with the realities of abortion as healthcare.
I have 9 minutes left that Zoom's actually giving me, but let me ask you this. You told the Postal Courier that elective late-term abortion does not exist. So why do you oppose a late-term ban?
So, I mean, then let's ban unicorns. Like, we shouldn't be writing laws about things that don't happen. So the reason we shouldn't write into law banning third trimester abortions is because it takes away choices for those women I was just describing. There is no benefit to writing that into law because people don't use that. People don't use abortion in third trimester as a convenience factor. The women who seek abortions late in pregnancy are doing so under the advice and in conjunction with their healthcare professionals. These decisions are made by tables full of doctors. You've got pediatric cardiologists, you have maternal fetal medicine doctors, you have the OBGYN, you have the NICU doctor, you have the palliative care doctor, literally teams of experts that we are so fortunate to have here in the Low Country at MUSC help these families through these decisions. You know who doesn't need to get involved in those conversations? Henry McMaster and all of his cronies up in Columbia.
Okay, there's a Huffington Post article that says the doctors in and want you to vote. How physicians are saving Democrats after Roe. So does that mean abortions equals less pediatricians?
Say that again. Abortion what?
So does that mean more abortions equals less pediatricians?
Absolutely not. Again, these are these inflammatory remarks that are being made. Like I said earlier when we were talking about trans kids, it's my job as a pediatrician to serve all of the children in the Low Country. I serve all of the children in the Low Country. That does not contradict with my position as a pro-choice physician. I understand that abortion is healthcare. I understand that banning access to abortion services is a gender equity issue. It's a racial equity issue. It's a maternal mortality issue. If we want to talk about how we care about kids in this state, let's talk about the gun violence epidemic, which is now the leading cause of death for children. Let's talk about our devastating maternal mortality rate, which is far worse for Black women in South Carolina than white women. Let's talk about expanding Medicaid. Let's talk about fully funding our public education system. That is how we can support children in the state of South Carolina, not through these archaic, draconian, forced birth bills that we're seeing out of Columbia.
Let's go right to it, the gun rights. You said this, it has been over 100 days since Roe fell. In 35 days, we have the opportunity to make this right by voting for pro-choice candidates. Nancy Mace will not fight to restore our rights. I will, unquote. In your study on youth mortality from gun violence, Dr. Andrews, how many of those deaths were actually gang related?
So, the way we study gun violence as researchers and physicians, we don't specifically call it gang related. We divide it into homicide, suicide, and unintentional shootings. And when we're talking about pediatric firearm deaths, we know that about 5% of those are those unintentional shootings, which I see far too many of at MUSC. That's where a young child gains access to an unsecured firearm, unintentionally pulls the trigger, killing themselves. Then we talk about suicide. Suicide makes up a third of pediatric firearm deaths. And then the majority are homicide, some of which are related to gang activity, some of which are drive-by shootings, many of which are domestic violence related. So the fact of the matter is, this is the leading cause of death for children in this country. These are preventable deaths. There are evidence-based solutions like expanded background checks and like federal secure storage law or a federal red flag law that have support from the majority of Americans, including Democrats, Republicans, gun owners, non-gun owners. The only place we cannot agree on these solutions is in Washington, D.C., and I want to be a part of the solution to help protect our children in their schools and in their communities.
So in that particular study on youth mortality from gun violence, why did you include 19-year-olds?
So the CDC, they actually do the cutoff at 19. They have different age brackets. And so you'll see some studies of pediatric firearm injuries that stop at 17. You see some that stop at 19, and you see some that stop at 24. The fact of the matter is you cannot argue that this is a problem. Talking about what the age cutoff is relatively arbitrary, I think, and misses the point that far too many of our children are being shot. As a pediatrician, I'm actually trained to take care of youth up to the age of 21. And that is the patients that we admit at the Children's Hospital, kind of depending on the situation. So those deaths are relevant to me as well.
Okay, gun violence, according to my research, Dr. Andrews, is not the number one killer of kids unless you add teens and young adults 18 to 19 years old to the mix. Almost 30% of all gun deaths are gang violence. 80% of all violent crime is gang violence. 60% of gun deaths are suicides, while less than 1% is from mass shootings, let alone with an AR-15. So what is your 5-point plan to combat gang violence?
So here's the plan. We need universal background checks on all gun sales, not just by federally licensed gun dealers. We need secure storage law. We need red flag laws. We need federal funding for hospital and community-based violence intervention programs like we have at MUSC. The Turning the Tide program is innovative, evidence-based, and cost-effective. And these programs are how we get to the roots of community gun violence and how we prevent these shootings from happening in the first place. But the fact of the matter is, our government has not been serious about funding these programs. So Dr. Ashley Hink, who is the medical director of the program at MUSC, you should interview her someday. She is incredible. She fights tooth and nail for every dollar that pays for that program because Columbia, the lawmakers in Columbia and our lawmakers in Washington, D.C. have not prioritized this. But the solutions are there. We just need leaders who will listen to the experts and leaders who will get serious about addressing this public health crisis.
So how many of those guns do you actually see in the streets?
So we have a huge problem with, licensed gun owners, but, unlicensed gun owners, folks who own guns that aren't licensed, that show up at crime scenes. We need to do all of those things I just talked about. We also need to fully fund our police department so that we can get these guns off the streets. We need to get this crime under control, and gun laws are an incredibly important part of addressing the crime that we experience in our community. And, I just want to, again, take a step back as to why I care so much about this issue. Just this morning, I had a text from someone who works on the surgical team at the Children's Hospital about the vast number of patients they have cared for just in the past couple weeks of children of all ages who have been shot for all different reasons. And it happens in our community all the time. And of course, because of patient privacy, I can't go on here and tell you all these stories, but it is critical that people outside the walls of the hospital understand that I am not on this soapbox because I'm some anti-Second Amendment person. I support the Second Amendment, but when you see children with bullet holes, you cannot help but want to find solutions.
And I have less than a minute, unfortunately. But let me go to the Post and Courier. This is from their news headline. They said this: Democrat Annie Andrews failed for months to disclose personal finances. And I can't go into details, obviously, because time is shrinks. But let me ask you, Dr. Andrews, why didn't the Democratic chair, Trav Robinson, help you to make sure you were in compliance with those disclosure regulations?
It's a great question. I'm a first-time candidate. I had no idea that those disclosures were a thing. Of course they are. As soon as the Post and Courier told us that we had not done that, we did it literally within a number of days. Now I am fully up to date. I have filed all the paperwork, but I don't know whose job it was to tell me that. That is a rookie mistake that the campaign made, but now my paperwork is up to date and publicly available.
Dr. Annie Andrews, thank you for your time. And again, welcome to Quintin's Close-Ups.
Thank you.